Hello, welcome to Palm Beach Orthopedic Institute. My name is Brian Hill and I am a board-certified, fellowship-trained orthopedic surgeon in shoulder and elbow surgery. If you are watching this video, you may be a candidate for shoulder replacement surgery. I'd like to speak to you today about the basic anatomy of the shoulder. Then I'd like to explain the difference of anatomic shoulder replacement versus reverse shoulder replacement surgery. Lastly, I think it would be beneficial to discuss the benefits of shoulder replacement surgery, but also discuss the risks involved with surgery. Let's start with the basic anatomy of the shoulder joint. The shoulder joint is a complex ball and socket joint that connects the upper arm bone, or the humerus, to the shoulder blade, or the scapula. It's one of the most flexible joints in the human body, allowing a wide range of motion in various directions. The head of the humerus forms the ball, while the shallow depression on the scapula, known as a socket or glenoid, holds the ball. This arrangement allows for movements like flexion, extension, abduction, adduction, rotation, and circumduction, making the shoulder joint crucial for activities involving the arm's mobility and function. Here we have this model to understand this further. Coming across the front of the model is the collarbone, or the clavicle. In addition, we have the arm bone, or the humerus, as well as the scapula, or the shoulder blade. This is connected by a rather large muscle that we can't see here called the deltoid. The ball, or head of the humerus, is held in the socket by 4 rotator cuff muscles. In the front, this is the subscapularis, the supraspinatus over the top, and then the infraspinatus and teres minor. Underneath all of this muscle, we have the joint, and this is really the priority of today. Between the ball and socket, we have the cartilage. The cartilage keeps the shoulder joint moving without friction. This is smoother than ice on ice. Unfortunately, as we age, the cartilage wears down just like the treads in our tires. As this wears down, we start to develop bone spurs or osteophytes. Further, as the bone rubs on bone, this causes pain because the bone has nerves. In addition, we get stiff and you lose range of motion. Some people even get crepitus or cracking whenever they try to move. All of this together is a process called osteoarthritis. Although osteoarthritis is the most common, there are other types of arthritis as well, and this can be caused by trauma, inflammatory processes, or even some medications can lead to arthritis. Aside from arthritis, we also have other things that can happen about the shoulder joint that can cause pain. Sometimes the rotator cuff can tear and pull back, and if the tear gets big enough, this ball can be pulled superiorly and rub on the undersurface of the acromion, causing further pain. Further, sometimes there is enough wear and tear where the ball rubs away enough of the socket, limiting our ability to replace it normally. When discussing shoulder replacement surgery, there are 2 options, either an anatomic total shoulder replacement or a reverse shoulder replacement. Prior to surgery, we'll discuss the differences between these 2 and decide which one would be your best option. First, I'd like to discuss with you an anatomic shoulder replacement. This is a model of an anatomic shoulder replacement. The reason we call it anatomic is because we attempt to replace the arthritis with metal and plastic that resembles your normal shoulder. With this surgery, we will place the ball or humeral head with a metal ball, getting rid of the arthritis. For the cartilage, we place this plastic, giving you a smooth surface to move the shoulder. But we do not change in an anatomic shoulder replacement is the rotator cuff. Most of the time, we think the rotator cuff is the motor of the shoulder. The rotator cuff compresses the ball into the socket, keeping it in place. In addition, combined with the other muscles about the shoulder, it allows us to move our arm and lift it overhead. Anatomic shoulder replacement is a very good option in a patient with an intact rotator cuff. When looking at the data of how long this will last, approximately 80% of people with anatomic shoulder replacements will have the shoulder last at least 20 years. The second option is a reverse shoulder replacement. We call it a reverse shoulder replacement because essentially we reverse where the ball and socket are placed. With a reverse shoulder replacement, we cut out the humeral head and replace it with a socket, like here. Then we place the ball into the socket of the glenoid. So in this replacement, the components are reversed compared with normal anatomy. One of the reasons we put this in shoulders is we want to provide shoulder stability in cases with a deficient or non-working rotator cuff. The reverse shoulder replacement is one of the latest innovations in shoulder surgery and a breakthrough for many problems. A reverse shoulder replacement is typically indicated in cases where traditional shoulder replacement surgery might not be effective due to specific conditions. Some common indications for a reverse shoulder replacement include 1. Irreparable rotator cuff tears. This is where the rotator cuff tendons are so extensively damaged and cannot be repaired. A reverse shoulder replacement can provide stability and improve function. Number 2, failed previous shoulder replacement surgery. If a standard shoulder replacement has failed or hasn't provided the desired outcome, a reverse shoulder replacement might be considered as an alternative. Another one is in patients with excessive glenoid wear. Sometimes the socket or glenoid wears away too much so that a reverse shoulder replacement might actually be the better option. In addition, complex fractures. This is where fractures of the humeral head or the upper arm bone cannot be effectively treated with other methods and may benefit from a reverse shoulder replacement. The reverse shoulder replacement tends to be a very good surgery. Based on our data, we can expect at least 90% of people to have a reverse shoulder replacement that lasts at least 10 years. Some of the benefits of shoulder replacement surgery include decreasing pain and improving range of motion and function. It does not make your shoulder normal, however. In about 50% of patients, we can expect their pain to be 0, and the other 50% of patients, they rate it as either a 1 or a 2. It's certainly important to discuss the risks of shoulder replacement surgery. Infection nationally, there is about a 1% risk. Males under the age of 60 tend to be higher risk. Also, people with uncontrolled diabetes are immunocompromised or higher risk. In addition, we can have medical issues such as heart attacks, strokes. Again, this is uncommon, however, this can be attributed to your medical health. Typically, we will send you to your doctor prior to surgery to make sure we can minimize any of these medical complications as much as possible. Another risk is pain. Certainly after the surgery, patients will have some pain. However, the goal is to relieve this pain after the surgery. Also, nerve injury. This is uncommon, but a very big deal. To perform the surgery, we must move your muscles around the shoulder, and sometimes nerves can get stretched. This normally affects about 1 out of every 300 people. Another risk is dislocation. This is uncommon, however, can be mitigated with the use of a sling after surgery. And specific to reverse shoulder arthroplasty is acromion stress fractures. This typically occurs in patients with softer bone and we believe is attributed to overdoing it initially. It is important to note the decision to undergo a shoulder replacement surgery should be made after a thorough evaluation by a qualified orthopedic surgeon who can assess the patient's specific condition and needs. Again, my name is Brian Hill, and I really appreciate you listening to me today.
One day I was fishing with my brother, and I was unable to pick up a 2-pound bass without using my other arm for help. Well, that's when I knew I had issues. I found Dr. Hill, and basically he had me figured out within 5 minutes. And one thing led to another, and got me a new shoulder, put it in reverse. This is a year later, and this is fantastic. Life after surgery has been fantastic. In regards to my shoulder, I lift weights 3 days a week. I ride a bike 3 days a week. I couldn't ask for a better experience.
My name is Paul Shaughnessy. I've been with Dr. Hill since 2021 when he did my surgery in December. And the recovery process and everything went very, very, very well. But when I was younger, I tore my rotator cuff. And throughout the years of working, it got worse and worse. And then I started playing pickleball. So I had to use my arm a lot more to swing the paddle, and the pain started getting worse and worse. So when I had to start using my left hand to play pickleball, it was time. The team is awesome. You know, from the time I came in and met Dr. Hill, he, gave me some options on what type of shoulder he was going to use, and then what the procedure was going to be, how long it was going to take, the possible recovery process, and then, just setting it up. Surgery went really, really well. My way of life has changed dramatically. The most important thing is I'm able to play with my grandkids. I can pick them up. I can throw the ball. With golf, I can hit the ball longer, and I'm not in a lot of pain by the time I get done with 18 holes of golf. And, pickleball, I'm able to use my right hand instead of my left hand to play. My quality of life is 100 times better than before the surgery.
If you'd like to contact us, either give us a call or go online to schedule an appointment. We look forward to hearing from you. Thank you.